Hello everyone, a very good evening and welcome to the AM MedTalk series. Yes, I have been joining you all every Sunday at 7 p.m. and every Sunday at 11 p.m. But today I have joined you at 7 p.m. and that's also because we decided to try and get our MedTalk timings a little flexible so that we are able to incorporate as many doctors, dermatologists, and aesthetic medicine practitioners as possible. And today I would be having Dr. Sonia Tekchandnani joining me. I am just waiting for her to join the live and then I will get her into it. But yes, having said that, I hope you all have been enjoying and getting all the insights that we have been trying to bring to you as part of the AM MedTalk series. Like I always say, this also becomes an opportunity for me to introduce you all to a lot of important events, dates, and activities that we are doing. So, aestheticmed.in is our website, and do go there for daily updates. So that you are up to date with everything that is happening in the aesthetic field. I hope you are downloading the digital edition of our magazines, but yes, if you like the touch and feel and wish to have a physical copy with you, do subscribe to the magazine. I think those details are also available on our Instagram page, so you can take it from there. And then the most awaited annual event, the conference, and the conference that we do every year. We have the conference this year in May. When I say this year, I mean 2025, and the details are all out. So we are going to be keeping more updates. But yes, if you are interested in being a speaker at our conference, having an exhibition space at our conference, or come and attend the conference, all you need to do is DM us on our Instagram page, and we are going to be there. So yes, I'm just waiting for Dr. Sonia Tekchandnani to reach us, and I am just seeing, checking quickly with her team. So in fact, if any of you were paying attention, we had just joined around 20 minutes ago when we were doing a quick trial to make sure, and I'm sure our doctors are busy in between their consultations as well, and yes, she should be joining us soon. So yeah, so having said that, yes, so this year our conference is again going to be a 2-day conference, and we are going to have it alongside an exhibition spread. When we say conference, yes, I can see Dr. Sonia over here, and let me quickly add her in because I can always keep updating all of you with. So I have just sent a request to Dr. Sonia, and I have received her request as well, which I'm accepting. So if you're wondering that where can you get the link to the magazine and everything, it's all on our page bio. So you can just go there, click on the link, and you would get access to a lot many things, a lot many details. Keep following us on the Instagram page. And yes, Dr. Sonia, I have received your invite and I've added you in. I've accepted the request. Just be a little more patient with us because I'm sure Dr. Sonia is going to join in any moment. Hello, Dr. Sonia. Very good evening.
Very good evening, Shriyal. How are you?
I am doing great. How are you doing, Doctor?
Well, you're looking lovely.
Thank you. Thank you so much. And welcome to the AM MedTalk series.
Thank
So,
you.
so MedTalk has been an initiative by us to just discuss, take your time, first of all, doctors like you to get your time and to discuss different treatments, discuss different ethics of practices and a lot more things. And of course, we always see the bigger picture at our annual event that happens once a year. but this is the 20 minutes of your busy time that we capture into AM Med Talk. So thank you so much for joining us in. I know how busy your clinic is at this hour of the day, and yet you've made the time for us. So thank you so much.
It's my pleasure. Thank you for the honor.
Yes, so having said that, to everybody watching us, I would like to give a quick introduction to Dr. Sonia Tekchandnani. She is a consultant dermatologist with Tender Skin International. And yes, just this week, she has celebrated 21 years of her clinic. And congratulations, Dr. Sonia, for that as well.
Thank you. But we missed you yesterday.
Yes, I missed being there too, but definitely we will make up for that soon.
Yes, I'm looking forward to
Yes.
that.
So today, Dr. Sonia and I are here very interestingly to discuss dark circles and dark lips, and we are going to discuss it through PDRN fillers. So how PDRN fillers can be used for dark circles and dark lips. I have definitely come prepared with my questions like I do on every AM Med Talk. But yes, of course, the comments are always open for everybody watching us. Feel free to put in your questions into the comments in case you feel I have missed out on anything for Dr. Sonia to respond. The live will be saved at the end on the page of Aesthetic Medicine India as well as Dr. Sonia Tekchandnani. So we would be collaborating and having the live displayed on our pages. So having said that, Dr. Sonia, should we begin with my list of questions?
Absolutely.
Super. Okay, so talking about PDRN fillers, and I'll go very basic to begin with, but how do PDRN fillers work in treating dark circles under the eye and dark lips at a cellular level?
So basically, they have a regenerative potential. Everything is about regeneration now, and the science of aesthetics is moving towards regeneration. So they work at a DNA level. Okay, so it stimulates the DNA to produce new collagen, to reduce the melanin pigment, and also improve the hydration of the skin. So what happens is when we do these treatments, we've been doing couple of treatments till now, isn't it? We've heard of PRP, we've done fillers, we've done surface treatments like peels and so on. So to add to the list, now we have this wonderful product called as a polydeoxyribonucleotide. Till now we were only talking about collagen stimulation, right?
Hmm.
Now we are working at a cellular level. That is a regeneration of not only collagen, but also there is neutralization of free radicals and instant hydration.
Hmm. Hmm.
So that's how
Right.
we'll be comparing, of course, with the other
Yes.
treatments as we
Yes,
go
we
along.
will as we go down the line. Yes. What are the primary causes of dark circles and dark lips? And then we would, of course, come to how does PDRN address these concerns. But just to begin with, what are the primary causes of dark circles and dark lips?
Primary cause, most of the cases which we see, they are genetic. Yes, there is a
Okay.
family history. My mother has dark circles. My father has somebody in the family or sibling having similar issues. Or nowadays we see a lot of screen time has increased. Okay, so stress-induced dark circles are also on the rise, and you also have to consider some medical problems. For example, you have a low hemoglobin. Your
Hmm.
hemoglobin is very low, or you have some allergies. Nowadays, you apply so many products on your skin. Everybody's coming up with makeup, and you don't know what's going in that makeup, and that can cause some kind of irritation or allergy to your skin. That can lead to dark circles. Then there are conditions like extremely dry skin conditions like atopic dermatitis.
Hmm.
So back in mind, you need to know what is the cause of the dark circles before we even touch it or treat it. Obviously, the treatment will depend upon the cause.
Yes.
And
Yes.
for dark lips, again, genetics, yes. Two, there could be some vitamin deficiencies. Three, we are seeing a lot of people using the matte lipsticks, dark colors. These are also giving rise to dark lips. And the most common today I am seeing is with smoking.
Hmm. Hmm. Hmm.
This is again on the rise. It's not gender based anymore, you know that. Everyone is, uh, either they are vaping or smoking or something or the other, and they have dry, dehydrated lips, then they have pigmented lips. The moment they enter, you can make a diagnosis that this person is a smoker.
Right. Hmm. And PDRN fillers help address either of these concerns, like whatever the outcome may be to the dark lips or dark under eyes, but you can address all of it with PDRN fillers, right?
So there are differences. For example, you see more of pigmentation, your skin is very thin, and you have like a poor texture of your skin. In such cases, the hydration level improves drastically within a week. The pigmentation goes
Oh.
down considerably. But when you're
Hmm.
talking deep, when there is a lot of hollowing, which is leading to dark circles. Like the shadowing effect is due to the tear trough, the deep tear trough. Yeah. In such cases, fillers are a better option. And
Hmm.
if you're dealing with poor texture and you're just looking for some kind of natural therapy, then we talk about PRP, which takes a longer time to see results over PDRN fillers.
Right, right, right. You mentioned PRP and all of that when we even started off with the live. But for dark circles specifically, how do PDRN fillers compare to other treatments such as tear trap fillers or PRP?
Yeah, so PDRN is a session-based treatment. Now it has three components. One, what gives you the instant result is reduction in the melanin production with antioxidants. That is the key antioxidant, the master antioxidant we all know today is glutathione. So this glutathione brings about that magical result. Two, it also has hyaluronic acid with a concentration on the lower side as compared to a filler. It's about 10%, whereas fillers have more, like 20 to 25%. So we see instant hydration, we see instant reduction of dark circles, and third is the PDRN itself, which has a potential of regeneration. The benefit of regeneration you will not see immediately. You
Hmm.
will see
Hmm.
over a period of time, like over the period of 2 to 3 months, right? So if
Hmm.
you have like minimal following, like a tear trough, and clients are, what is your concern? Is it your pigment or is it the hollowing? Right?
Hmm.
What is bothering the client more? So when we're looking at client has pigmentation but minimal hollowing,
Hmm.
and you need to hydrate the skin. You need a lot of textural improvement in the skin. That's where PDRL stands out as a treatment. And those who are having a lot of concern about a filler, the moment you talk of a filler, the client say no, I don't want to go in for this, right? Because the filler is going deep down on your bone, whereas a PDRN is just like a PRP, tiny injections, like how you do on the face, we do under the eyes. So the downtime is less. There's no visible swelling. In a day or two, everything subsides. And in 1 week, amazing change in the pigment. Hydration
Hmm. Hmm.
level drastically changes, and that's where it stands out. But you
I
have
think
to
you've
stay.
almost answered my next question in a way because I was to ask you that any specific benefits that PDRN provide to pigmentation issues, on delicate areas like the lips. So I think you've already answered that when you say that the drastic change you see within a week.
Yeah, it's definitely within a week. And but only thing the client needs to know is that this is a session-based treatment
Ah,
where
okay.
you do once a month initially for the first 3 sessions, and then you can just leave it for about 6 months.
Oh.
So pretty much comparable to a filler with the additional benefit of reducing your pigments as well.
Hmm.
So many
Hmm.
times
Hmm.
they come, we've done a filler for the hollow, for the teardrop, for the hollowing or the deep set eyes. They still come back saying, Doc, my pigment has reduced, but it's not gone.
Okay.
Yeah, so for that, in the beginning only, there is an evaluation to say whether the pigment is due to the hollowing or not due to the hollowing. So in that time,
Hmm.
only we tell them that now we'll do a filler that will improve your hollowing because that is your primary concern. But the surface pigmentation, we'll still have to address it.
Hmm.
So a
Hmm.
little later, maybe after a month or two, and we have seen like wow results when we combine it. So
Are there any
sometimes they're
contraindications
not
or
doing the
skin?
same session. We do one session, we done a filler, just left it there. After a month or so, when they come back, their concern is a dark circle. That's where we introduce this product to them.
Ah, correct. Right. Okay. Hmm. And are there any contraindications or skin conditions that would make patients ineligible for a PDRN filler treatment in these areas of under eye, like dark circles or lips?
So very much like if you're doing a filler, we ask the same questions. You have any allergy to the product? Do you have any autoimmune diseases? You have any active infections in that area? Which of course we only assess.
Hmm.
Are you pregnant? So these are some of the questions we need to answer even before any cosmetic treatment. And same applies over here.
Hmm.
Okay. So generally it's better to do a test patch whenever you use any new product from the client. So what we do is an intradermal test dose before we even start doing any treatment for the first time when you're doing. Some people may be allergic to glutathione. Maybe somebody is allergic to the PDRN itself.
Hmm.
Okay. So it's always better to do a test dose. Now fillers now they are time tested, so we don't need to do hyaluronic acid fillers are time. We don't have to do any sensitivity test. But with all these products, we have to be safe before you inject any product.
Hmm. And what kind of visible improvement should patient expect, and how soon after treatments can they see the results? Now, I know somewhere you have touched upon this, but what we can elaborate over here is also depending on the causes of the darkness or the intensity of the darkness. How soon after the treatment can the results be seen? And what improvements can the patient expect? Is there like 100% improvement, or what is it like?
Yeah. So first and foremost, we always tell them you can consider an improvement. Pigmentation, we never say it goes away. It improves
Right.
drastically, yes, that I definitely say that you will see a change immediately. In a week's time, you'll see your hydration is better, your pigment has reduced. But over a period of 2, 3 weeks, they get even better. So when they come to us at 1 week for a follow, and again they come to us after 1 month for the second session.
Hmm.
So that 1 week has obviously, multiplied in the next 2, 3 weeks. So they're even better when we see them at the end of 1 month. And
Hmm.
then there is a second session which again boosts the result of the first session. Okay, so end
Hmm.
of 3 months is where we say some collagen buildup has happened, some regeneration of tissue has happened, and if they had a minimal tear trough, that is totally covered, and we remove the apprehension of a filler from that client. So many times there are clients who have very minimal hollowing, but they are still concerned about it that I don't like this. Okay, here is where this product fits in very well.
Hmm. Hmm. Do you think there are any kind of myths around the using this product or applying it to oneself? Are there any myths making the rounds? We see a lot of aesthetic treatments and that have myths that are surrounded by myths rather. Is there a similar case for PDRN that you've heard about?
Not really, but yeah, I mean, whenever you talk of injectables, they are scared.
Hmm.
They will say, "Oh no, it maybe it will migrate the filler,
Hmm.
or if you will not injected the right depth, so then they say, oh, will I get some bluish discoloration of my eyes? So these questions come with fillers as well, and is there any permanent side effect? Oh, I hope I won't get any permanent side effects with this.
Hmm.
So over the last 1 year, we have seen that this is one treatment where we have seen minimal downtime and good results. So till now, we have offered them so many treatments. We do in combinations. For example, you're looking at
Hmm.
a surface pigment. We do a mild peel, like a glycolic or a lactic peel, that helps to remove the dead skin, makes the skin texture better, and then you inject it. Obviously, the result is better. Or we combine with, if you have puffiness along with dark circles, then we combine with the radio frequency. But again, the non-invasive treatment goes in first before we inject the product. Okay.
Hmm. Hmm.
So yeah, combination treatments have also helped a long way in managing these conditions. And till now, we used to say dark circles is a very difficult condition to treat, but now I confidently say no, there is a treatment and you will see a drastic change. Yeah, but
Nice, nice.
also we comment only when the, pigment, we comment, we only give them assurance to a bit where they'll be satisfied, because sometimes we see real pigmented eyes, not only under the eye but also above the eye. So let me tell you, this product is all I've been also using on the eyes.
Okay, okay.
Yeah.
Hmm.
And we've done couple of cases where we've done hands also now. They have pigmented
Oh.
knuckles, they have low hydration, they have wrinkles on their hands.
Hmm.
And similarly, this product, I think the last conference, Dr. Shweta also presented on this. So there was a client who had pigmentation on the full face, forehead, neck. That's called as lichen planus pigmentosis. And
Right,
after I heard her, I also started doing on these kind of clients. And on these clients also, we are seeing amazing results.
right, right. In fact, Dr. Shweta Nakhawa also went on to write an article for us on PDRN. So, in the recent edition of the magazine, we have an article also covered actually. So,
Oh,
yeah,
nice.
for everyone watching us, you all can even go and read more about it in the latest edition. The link is in our bio. But yes, coming back to my questions, when in a situation when PDRN fillers alone may not suffice, what is your approach to treating stubborn pigmentation and discoloration? How do you approach it in this scenario?
Yes. Some in-clinic treatments, like we start with a very basic thing like a surface, for the surface pigment or the dead skin, the epidermal pigment. For that we use mild peels, and the same session we do the PDRN, or we combine with an IPL or a radio frequency depending on the concern again. And not to forget that you need to give them a good home care also depending on the concern. Like with aging, you see a lot of fine lines, wrinkles, and that may be the cause of, the dark circles itself. In such cases, we
Right.
add some retinols to the regime, some antioxidants like vitamin C, some skin lightening agents. You must have heard of kojic, niacinamide. These are very, very subtle products, but they have amazing results.
Hmm. 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 And do patients typically require any kind of maintenance sessions for, these dark circles or dark lips? Like we know a lot of treatments, like the post-treatment maintenance plays a very crucial role. So is it required in this case also? And if yes, then how often? Like what does the entire maintenance of it
So
include?
definitely maintenance is required. Maintenance in the form of home care, as I already mentioned, that is one, to maintain the result of treatment. But at least once in 6 months, you need to repeat the treatment. Once you've finished your first 3 sessions, monthly sessions you've done, then you do a maintenance sessions every 6 months.
Okay. Okay. Also, I think, doctor, aftercare is very important. Just like how maintenance is important, but I think aftercare becomes even more important to show results. Like it can make or break all the effort that has gone into.
Yes, yes.
So, any aftercare protocols that you would recommend to ensure optimal results and minimize post-treatment side effects?
Yeah, first of all, whenever you do any injectable treatment, first thing is do not you wash the treated area for at least 12 hours. Okay, and the
Hmm.
first wash which you should do is always with filtered water or sterile water.
Hmm.
Because for 12 hours at least, your injection sites remain open and they're more prone to infections. Especially the water which comes directly from in your taps. They may be harboring some kind of mycobacteria. These are organisms which can cause tuberculosis. Okay? So this is
Hmm.
my first instruction to my client, whether I do a PDRN or I do any other injectable procedure. So after 12 hours, the first wash is done, and then you can resume your regular water, regular face wash, no problem. And the second thing I always tell them is that do not do any heavy exercise for at least for the next 48 to 72 hours. And
Hmm.
no excessive swimming, don't go for swimming. Steam sauna to be avoided for a week. And do not massage
Hmm.
the treated area for at least 2 weeks. Sometimes they just go and get some facials done afterwards. So that
Hmm.
is one
Hmm.
which you need to tell them that the treated area should not be. massaged vigorously.
Hmm. Hmm. Hmm.
And then after a week, we asked them to resume the skincare routine, the under eye regime, which was suggested to them depending upon the concern. That is definitely a part of the routine. Plus, you should rule out all the medical conditions and touch upon the treatments for that along with doing these treatments. Treating the cause is very important, and then the topical therapy, the injectables, that is what is goes a long way in the management of the condition.
Right, right. And I don't even think even makeup or any other chemical product usage would be advisable, right? Immediately post.
No, at least for 72 hours, we don't allow any makeup.
Hmm. Hmm. You did mention combination treatments that, PDRN can be used in combination treatments. So if you can just touch upon any innovative combination treatments or complementary treatments that enhance the effect of PDRN fillers in these areas of eyes and lips that we are discussing today.
Yeah, for example, you're looking at textural, a lot of textural changes have happened due to aging. In such cases, you've done a PDRN today, after 2 weeks, you could do a microneedling.
Okay.
So that also helps to build collagen in that area. So it's like a synergistic effect where your PDRN is acting at the cellular level and your microneedling and PRP, they help to rebuild the collagen through a more natural approach.
Hmm.
So
Hmm.
these are
Hmm.
some of the treatments which are recommended as a combination, but depends on the concern.
Right. 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 Sure. So, Dr. Sonia, for doctors who have just started with PDRN fillers, as well as for patients who are still contemplating if they should go in for PDRN fillers, what would your advice be to both sides? What would you advise to doctors who are just going to use PDRN fillers and for patients or clients who are contemplating the use of PDRN fillers?
Yeah, so first I asked them, are you phobic to needles?
Ah. Yes, a lot of us, and those who are phobic to needles, I think you as a doctor would have seen how adverse it can get.
Yeah. So what we do is we get started with a conventional therapy, after treatment,
Okay.
after understanding the cause and, what treatments will help the condition. Along with that, and once they're a little more comfortable and they're looking for more better results or enhancing the result of what they have got, that's where we say, we keep counseling them at that level that
Hmm.
now I think you should try this, it's painless. And actually, it's absolutely a painless treatment. You won't believe it. After you have numbed the skin, none of the clients have ever complained of pain.
Hmm. Even after the numbness goes, even after the numbness leaves away, you don't feel any pain over there.
No.
Hmm.
You may have a swelling for a day or two. That's it. We have not seen any discomfort and panicking and calling, this is what happened to me. Maximum what has happened is a bruise. Yeah, because
Correct. Correct.
ultimately you're treating an area where the thin skin is very thin and there are a lot of blood vessels in the area. So we tell them that, yeah, you may get a bruise, but that settles in a week's time.
Hmm. We have a question from Aisha that which treatment is best for the under eye? If you can explain. I know we are discussing PDRN today, but if you have any other treatment to respond to her as well, along with that or in combination, then you can go for it.
Uh, Aisha, I think you heard the whole thing, and we
Yes.
first need to address the underlying cause, isn't it? And then do the treatments accordingly.
Yes. So Aisha, I think there is nothing as best treatment, but you should leave it to your dermat to decide best what treatment should be applied to your condition. Am I right, Dr. Sonia?
Absolutely.
Yes. Also, a question from Nidhi Arora while you were talking about PDRN that what is the amount of dose injected per shot?
So maximum we have injected under the eyes
Hmm.
is about zero point 0.5 ml.
Okay. Okay. So, Nidhi, I hope that answers your
We
question.
use very thin needles, and we use those insulin syringes to inject. So the needles are absolutely tiny. So if you consider the dose in the insulin syringe, it will be around 20 units. That's it.
Okay, okay. Perfect. Thank you so much, Dr. Sonia. I had requested 30 minutes of your time and it's 30 minutes up. So that brings us to
Oh,
the
lovely.
end of today's AM Med Talk. It's passed so soon, I didn't even realize the 30 minutes passed with all the information that was flowing from you to my questions. But yes, thank you so much, Dr. Sonia. Always a pleasure. Having you join us, be it on live or at our annual conference, you are always a wealth of information for us.
Thank you so much, and you are a wonderful anchor. Actually, even I didn't realize that I was talking for half an hour.
No, no, thank you so much. And I'm sure you still have a busy evening. It's not yet the end for you. So, wishing you a great evening again, and we will catch up soon. Aisha says that she's a big fan of yours, Dr. Sonia.
Thank you, Aisha. Would love to meet you.
Yes. And with that, I will sign off. This is Shriyal Setumadwan, the editor of Aesthetic Medicine India. And with me today was Dr. Sonia Tekchandnani from Tender Skin International. And we are going to be saving this live. So if you have just joined in, if you missed joining us right from the start, do not be disappointed. You will get to watch the live again. And in case you still have any questions or comments, you could leave it on the comment box even after it is saved. And we will connect with Dr. Sonia and have your questions answered. Okay, so with that,
Thank
wishing you
you.
all a great week. And Dr. Sonia, have a great evening ahead. Thank you so much.
Same to you. Thank you for having me here. Thank you.
Bye.
Have
Bye.
a good evening.
You too. Bye.